Hi guys, praise Jesus. If you see me branded like this, jua nimewakujia na mambo mzuri. Yes. Am I an influencer for this particular company? No. But I am a partner with Jubilee Insurance. I have been for quite a while now. It's been quite a number of years, but right now ndio mapenzi yetu ni kama imerudi pale kwa honeymoon stage, because the way Jubilee Health Insurance is bringing us products left, right, and center for everyone. Anyway, so here I'm here to introduce to you three important products that Jubilee Insurance has introduced to the market. And when I say introduced, nasema zile products zenye ziko hapa, affordable products. Three affordable products that Jubilee Health Insurance has. Why? Because you don't have no excuse to say why hauna insurance. We cannot be adding people to WhatsApp groups every single day as we work so hard just because kuna issue imekuja tu come up. And yet we can protect ourselves. We can cover ourselves from these things. We are human beings. Kuna watu wanasemanga, oh, I'm a Christian, so Jesus is my insurance. Yes, Jesus is your insurance. But he also wants somebody with wisdom. And the reason why God created us with all this know-how, why God gave us an opportunity to be able to know how we can build houses, how we can come up with security. Kwa nini kuna security guards? We mwenye unasema Yesu ni insurance yako when it comes to health, uko na watchman kwa gate. We mwenye unasema Yesu ni your insurance when it comes to health, you are the one umeweka password kwa simu. Kwani umeweka password kwa simu? Si uiache tu. So basically, let's be realistic and just say that health insurance is important for every person. You might say, sijai visit hospitali. I get so much of that when I speak to people. Unasikia mtu akisema, mimi, I can't even remember the last time nilienda hospitali. But we are not telling you to get covered because you're getting sick. We are telling you to get covered in case you get sick. That is the point. So that when that particular time comes, I'm not saying it's going to come, but if it does come, we are human beings. Hizi mwili zetu ni, we are just flesh and blood. And flesh and blood is prone to these things. Kahoma hapa na pale. Sahi cancer inapata tu just anyone, even children. It's just, I don't know. And I am here to speak to those people who feel like health insurance is very, very expensive and they cannot afford it. We have three affordable covers. The newest baby in town is called Cover Nafuu. Cover Nafuu, I'm sure most of you have not heard about it. It's an in and out. It's an outpatient only cover, one of a kind. An outpatient only cover, one of a kind, one that you can literally sign up using your telephone. Na hii nayo ninakupatia kama bila kugatekeep, because I will not earn anything from you buying this cover. Okay? So when I tell you about Cover Nafuu, hapa hivi ninafanya kazi ya Yesu, and it's okay. I don't feel bad because I am not going to gatekeep when there is information that I should share. Somebody else might not even bother sharing it because they'll imagine, where am I getting my commission from? And so Cover Nafuu is the newest, and it is very, very new. When I say very, very new, imeingia kwa market like literally this weekend. Okay? So what does it do? What does it have? What does it cover? It covers doctors' consultations, it covers laboratory tests, it covers prescription drugs, it covers dressings for minor and outpatient procedures, and it also covers preventive care, health promotion services, and basic screenings. For example, unaweza enda tu ufanyiwe medical checkup. Uangaliwe tu kama uko sawa, hata kama wewe si mgonjwa. It's good to get to know these things. Sometimes people are getting to, tuliambiwa Betty Bayo aligonjeka na by the time adiagnoziwe ni nini ako nayo, aliambiwa ni cancer ikiwa stage 4. That was it's sad. It's really sad. So it gives you that opportunity, and it also covers chronic disease management. Those are conditions like arthritis, diabetes, and all that. Of course, there are waiting periods going to be there, and then there'll be KPI vaccines and also emergency stabilization before referral. What can you do with this cover? This one you can couple it up with a cover that we have been selling, a very, very good cover called Cover Bora. First of all, what are the costs of this cover? Hii cover nafuu ni very, very cheap. Very, very cheap. But I say very cheap. This cover you can pay as low as 4,000 shillings. But now, if you have a family, and you want to get this cover for you and your family, it is very simple. If you're taking a cover for you, maybe you and your child, mko wawili, you'll pay 7,800 per year. For 3 people, you'll pay 11,400 per year. For 4 people, you'll pay 14,800 per year. And for 5 people, you're going to pay 18,000. What does it cover? It even covers you. How much? Up to how much does it cover you? My friends, unlimited. Mumesikia ingine wapi kama hiyo? Mimi, and you're asking me, why am I falling in love with Jubilee Health Insurance lately? Why am I still their partner? Because they keep coming up with the best of the best. Who is it for? This healthcare is designed for everyday Kenyans, affordable, simple, flexible, and dignified. Ata kama hauna hata shilingi, you will walk into a hospital, utapewa dawa. Cause inakava nini? Inakupea dawa. Mtoto wako kona katonsil hapa na pale, peleka mtoto. Start with this cover. This is a cover that you can even get for your house managers. This is a cover you can get for your friends or for your relatives. Hii kitu ya kushinda ukiambiwa nitumie 200, nitumie 1,000, mtoto ni mgonjwa. Do something. Baby daddies, kujeni hapa. Ati mama saa zingine hata naekeleanga mtoto si mgonjwa, mnunulie cover nafuu huyo mtoto wako. 4,000 bob. 4,000 bob baba. 4,000 bob. Urudi uongezee ile ingine ya 6,200. 10,200 shillings. Mtoto wako ako on cover. No more baby mama drama. Mtoto wako ako covered in and outpatient with 2 different covers. Another cover that I wanted to speak about is the Cover Bora is a bit more detailed because that one covers you for in and outpatient with an inbuilt maternity on it. Hii nao ni ya wale watu wenye last emergency, umebeba mimba miezi 9. Kama mimi, there's a time I did that. There's a time I carried my pregnancy for 9 whole months. Actually, fika 9 months. Ilikuwa around 8 months and something because actually nilipata mtoto wangu like 4 weeks before my due date. 4 weeks before my due date. So I was relying on NHIF, which is now SHA, that time, and I went to a hospital. I'm going to mention the hospital. It was Roy Family Hospital. Then hawako wamekama up na hiyo kubwa, the complex one, hiyo the big building. It was just another one that ilikuwa tu kwa building tu kadogo hapo. And I went and I told them, can NHIF cover me? Yes, it's going to cover you. And then the day comes, my friends. Oh, your NHIF haijamachua. Oh. So yes, here we are. Cover Bora gives you an inbuilt maternity that can cover you. That has a waiting period of how many months? 9 months. Meaning, unaweza ingia Cover Bora hii mwezi. Next month, shika mimba. You're covered. Want you mtoto asikuwe premature, ombe Mungu. So basically I usually say for this one, give it like 2-3 months. Then it's going to be good for you, just in case of eventualities of anything. Okay. What else am I going to talk about? There's a cover we call Johari. Now, Johari is a coupled up cover for in and outpatient, but now this one has limits. The limits are what? There's Plan A that has an inpatient of 250,000 and an outpatient of 40K. And then Plan B has an inpatient of 400K with an outpatient of 50K. At least this one has limits. So this one also comes in with an inpatient, with an inbuilt maternity cover. But the waiting period for this one is 1 year. The waiting period for maternity in this particular one is 1 year. Now come back to Cover Nafuu. Turudini kwa Cover Nafuu. Cover Nafuu nayo, it does not cover for MRI, CT scans, X-rays. Hizo haifanyi diagnostics mzito kama hizo. Haikavi for day surgeries. Okay? So basically hii ni cover tu. Na umesikia the advantage of it is what? It's unlimited. Hii ina cover tu for those minor things. But it's okay. It's better than having nothing. Okay? Yes. So kama hauna cover, ni wewe kutaka. because basically this is something that you can take up for your family and for yourself. Okay, so hit me up on my number.